4 questions you should ask before you leave the exam room, Endo Edition. Hi, I'm Christy, Women's Health Nurse Practitioner and founder of Blush Women's Health Consulting. The first question you should ask is, how was my endometriosis diagnosis confirmed? So confirming endometriosis is a biopsy that's done in a surgical way. There is a working diagnosis of endometriosis, which is typically seen if you have the classic symptoms of endometriosis, but we have yet to schedule you for surgery to confirm that you have endometriosis. The second question you should ask is, what stage of endometriosis am I in or do I have? And you'll get the answer to this question once you get the endometriosis surgery. So there's 4 stages of endometriosis. There's minimal, mild, moderate, and severe. And you'll know this based off of the location, severity, and the adhesions of the tissue, and your surgeon will tell you exactly what stage of endometriosis that you're in. The third question you should ask is, what are my treatment options? In my opinion, this is the most important question that you should have understanding about. So this means, what are pain management? What are medications I should take? What does this look like in the long term? What are the intervals I have to follow up again? Because endometriosis can come back, maybe in 5 years, maybe in 10 years. So it's important for you to have an understanding of how you can manage this pain so you don't suffer for a very long time. The fourth question you should ask is, how does this affect my fertility? Now, granted, let's say you're not thinking about children, you're like, oh, whatever, I'll worry about that down the line. No, it's important for you to understand, what does this look like down the line so you can better prepare yourself? As in, what treatment options should I do? Because a lot of times patients, they find out they have endometriosis when they're struggling with fertility, then they have surgery, then they realize, oh my gosh, I have endometriosis, and that shifts a lot of things and also brings a lot of unwanted stress that you're already stressful about in that moment. So understanding how endometriosis affects your fertility is very important because it helps you plan for the next steps of what works best for you. Thank you so much for listening, and follow for more women's health tips. Bye!